Hello everyone, I am Dr. Imran. I am consultant cardiologist in TX Hospital. Today I am going to talk to you about the effects of smoking and its ill effects on the body. Smoking, as we know, has become very rampant, especially in young people, but it is one of the most dangerous thing which is picking up right now. Smoking causes multiple effects on the body, starting with your heart and blood vasculature. As we know, smoking is atherogenic. Atherogenic in the sense it increases the risk of atherosclerosis. That is, you get blocks everywhere in the blood vessels. Like you get blocks in the heart, you get blocks in your carotid circulation, or in other words brain. You get blocks in the peripheral arteries. So as a result of smoking, you can have acute MI. Person comes with chest pain and all the other complications associated with smoking. Nowadays you are seeing a lot of young people dying suddenly because of chest pain and acute MI. Most of them don't even reach the hospitals. Recently it has been detected in very young actors also who are neglecting their chest pain. Most of these people, I have seen almost about 90% of the patients dying of heart attack in young age group, they have smoking as a very common risk factor. They don't have any other risk factors like diabetes or hypertension, but most of them, almost 90 to 95%, are smokers. So it is very important that you just avoid smoking. Smoking also causes some other diseases, like you get stroke in young people. Many young patients we are seeing who come with hemiplegia involving left half, right half of the body, and the most important risk factor among these people is also smoking. Smoking also causes something called as peripheral artery disease, where your blood vessels in the peripheries get narrowed down. So you get limb pain. Whenever you are walking, you come with pain in the limbs, either in the thigh or in the legs. So this is very critical. You do multiple surgeries, even then this is not correctable. One of the not correctable disease is peripheral artery disease. So apart from smoking causing these effects, it also affects other organs in the body, like it affects the lungs. In lungs, it causes a condition called as chronic bronchitis and emphysema. These are usually chronic conditions where the person who smokes for 10 to 20 years, his lungs get affected in such a bad way, it is almost like irreversible damage. There is no lung remaining. Only thing is some expanding volume of tissue is there, which impairs gas exchange, and you get lot of breathlessness. Because of this, you get right heart failure. You come with you have swelling of the lower limbs and other features of heart failure. And apart from these things affecting the lungs and the cardiovascular system or the blood vessels, smoking also affects other bodies. It can cause cancers in various organs. You have seen a lot of smokers coming with cancer of the lungs. Smoking also causes cancer in some other parts of the body, like your esophagus or your stomach, pancreas, bladder. All these are the ill effects of smoking. Smoking, even in pregnant ladies, can affect the babies. It can cause low birth weight babies. It increases the risk of other diseases also. So it is very important that you stop smoking, as beneficial it is that you stop smoking. So I suggest you that apart from other risk factors that you take care of control, like your diabetes and hypertension, it is very important that you quit smoking. Smokers, when we have seen that we do angiogram, their blockage, we put a stent. Even in those people who consume smoking, after putting a stent, the stent gets blocked. So it is very important that you quit smoking, and that's it. These are the harmful effects of smoking. If any other queries are there, just you can comment in the comment section and we'll get back to you. Thank you.